So today we're going to be talking about non-surgical options for hair loss. Now this subject's quite broad and there's lots of different things to cover, so it can be quite overwhelming for people to understand, which is why I think if we just break it down into the most popular treatments people go for non-surgically, then you've got that comparison with surgical options as well. Typically for someone who wants to go for non-surgical hair options, the best type of patient for this is someone either male or female who's first starting to notice the initial signs of hair loss. So we're talking about thinning of the hair, we're talking about maybe when they're combing their hair, they're seeing maybe some hairs on the end of the comb that they didn't notice before, and not quite bald patches, but we're starting to see just hair thinning in certain areas. That type of patient is going to be the best type of patient who might respond well to non-surgical options. With patients who've got more extensive bald patches or they've got complete hair loss in certain areas, surgical might be the only option for people like that to really look into and consider. So the aim of this video really is more tailored to either men and women who are experiencing hair thinning or the first signs of hair loss. So in terms of the reasons why this happened, there are loads of reasons that I'm just going to touch on without going into too much detail. So in terms of reasons for hair loss, the most common one for men and women is just going to be genetic or hereditary. So some people lose hair earlier than others, and it's quite difficult to manage that aspect of it. But other things that are going to help contribute towards this are going to be things like stress can be associated with hair loss. There can be certain medical conditions such as thyroid issues, for example, which can be associated with more hair loss. There are different treatments and medications which can lead to hair loss as well. So it's always worth discussing that with your doctor at the time if you are on any medications. Other things to factor could be certain treatments like radiotherapy is going to be obviously a noticeable one for hair loss. So PRP, or platelet-rich plasma therapy, is an evidence-based practice in which we take a sample of your blood, we spin it around, and then we take out the platelet-rich components of that. Now what these do is they can work with your growth factors, and essentially they can help improve blood flow to your hair, and that's going to improve the quality of your hair. In terms of the evidence base for this, it's a lot more vast than other non-surgical treatments that exist. So to start this off, I'm going to talk you through this paper which was published in 2015 looking at PRP treatments for hair. So this was published in the Journal of Stem Cells Translational Medicine, and essentially they were looking at PRP as a treatment for male pattern hair loss, and they investigated 20 men where they were treating, using PRP, half of their scalp with a placebo and half of their scalp with the PRP. The patients received 3 treatments each, 30 days apart. After the cycle for 3 treatments, patients were followed up for 2 years, and there were lots of different parameters that were looked at to judge the results. So when we're looking at or appraising a paper, there's lots of different things that we think about. I mean, in this case, it's quite a small sample size, but then again, there are so many different papers that have been published on PRP, which is why, as an evidence base, it's going to be a lot stronger compared to some other treatments for hair restoration. It's also worth pointing out that in all of these papers, it's never a case that 100% of the people who receive the treatment get a great result. In general, whenever you're doing any medical-based procedures, results are never guaranteed and it's going to be quite variable. We're making suggestions as to things that should be able to help, but we would never say that this will definitely be the cure to all the problems that there are. Next, I'm going to talk about viviscal, which is a really common and popular hair supplement that people take. Which essentially is a mixture of different things that are going to help their dietary requirements for things that are going to optimize optimal hair growth. Now, supplements themselves are quite a contentious subject because all the supplement companies themselves are going to produce loads of data and trials saying, try my supplement, is the best because of all of these reasons. And then you're going to get skeptical people who are going to be saying, well, actually, everything we need can be obtained from the diet. And there's always going to be a bit of a battle between these two waves of thought. The thing I like about viviscal is their evidence base is over a 25-year history. So it's the biggest type of company that's existed in this space for a long time. And within that period, there have been 12 clinical research papers that have been published talking about its benefits. Viviscal claim actually that 1 sachet of their supplement is sold every single minute. So this is millions and millions of people who are using this as a supplement. Now, it isn't as clear cut as to say, okay, everyone who uses this supplement is having great results, because if you look into it, you're going to find lots of people who are unhappy with that supplement. Like any other supplement, you're going to get some people who swear by it, and some people who think it's all a waste of money. And both sides of those coins can have valid opinions. Lastly, we're going to be talking about polynucleotides, which are probably the newest option on the list. So polynucleotides are fragmented DNA of a salmon that combines with your own DNA, typically the fibroblast cells, to produce more collagen and elastin. More collagen and elastin within the scalp can help a little bit with the formation of the hair follicles, and it can help the quality of hair that's being produced. So I'm going to talk you through this 2021 paper that was published in the Journal of Cosmetic and Aesthetic Dermatology. This paper was a consensus report looking at the use of polynucleotides in aesthetic medicine and looking at it across different indications. For example, the skin, under the eyes, the scalp for hair, and various different indications that the treatment can be used for. Focusing on the scalp more, this is what they had to say. The scientific board reached a high level of agreement on the efficacy of polynucleotide-based treatments for hair thickening of the scalp. The polynucleotide injections were actually able to help revive hair follicles. The effect of this is to promote and accelerate hair growth, and this is associated with the growth of stronger and healthier hair shafts. The recommended treatment protocol for polynucleotides is to have 4 sessions spaced about 2 weeks apart, and then after then to have another 4 sessions more like a month apart. So in total 8 sessions over a year is what typically you'd be advised to have to see significant or noticeable improvement in the hair thickness and the hair quality overall. So to summarise, there isn't one answer that's clearly the best one, and our approach in clinic is actually to combine them all together for a complete hair restoration plan. So the PRP is used to improve blood flow, and when we've got improved blood flow, that's giving the vital nutrients to the hair to optimise the growth. To make sure we've got the correct nutrients, the supplement's going to be useful, because at least we know that we're going to be using the best things that we can to optimise that aspect of the hair regrowth. Finally, with the polynucleotides, that's more focusing on the regeneration of the hair follicles and optimising the hair follicles. So these 3 together are going to work together to try and give the best type of result. Even with that in mind, with hair treatments, it's never guaranteed, and this is one type of treatment where actually it's definitely not suitable for everyone. So these type of treatments are only good in people who've got thinning hair or who are noticing the first signs of hair loss. And in this case, usually we don't say this, but if it is too late, it might be too late for these type of treatments, and in that case, surgery is going to be the only option. So our treatment protocols with this are usually going to take place over a 3 to 6 month period where people are going to have monthly treatments, and then following up it's going to be more infrequent treatments like once every 3 months or so. With hair treatments, it is a long-term thing, so it's not a case of we've fixed it and then it's fixed forever. But even if someone were to get a surgical hair transplant, these types of patients still need hair maintenance treatments too. So if someone's just genetically predisposed to losing hair quicker than others, they do just require more frequent treatments to stay on top of it. So thank you so much for watching. I hope you found it useful and educational. If you've got any questions, please do let us know and we'll get back to you in the comments. Thank you.